And now let's come back home, because just like the Ghana port, the Ministry of Health wants to go paperless. What this means is that you don't need a hard copy folder to access healthcare. Everything will be done online. The project will be launched today. We'll take you to the launch grounds now.
We are gathered here this morning to launch this innovative program which will enhance health delivery in our country. We thank you for the government and all the innovative programs that they are coming up with. Even as this is launched, we commit the implementation unto your care, that you grant all that implementers will need to make it a success. We thank you that it will go further to even enhance and promote the quality of life for our people. Preside over all that we're doing here, because your word says where two or three are gathered, there you are in their midst. We thank you, we bless you for a successful launch. In the name of our Lord Jesus Christ. Amen.
Okay, coming to the microphone, I think I would announce that we should give Reverend Ogwase another round of applause, please. All right. At this juncture, I was expected to introduce our special guests who will be gracing this occasion, but I'm told they are on their way. So in the meantime, I will just ask all of you who are present here this morning to tell us what your expectations are. Because as a matter of fact, I can see a lot of health practitioners amongst us, nurses, lab technicians, doctors, and a few other areas of health. So you can share with us what you make of hearing that something like this is coming, an e-health system, which is going to help in ensuring that we all have one database that would keep our records and ensure that we get the best health care. It's going to help a lot of our stakeholders as well, the Food and Drugs Authority, the National Health Insurance Authority, and a few others that are all partaking in something as new as this. So if I may, who would like to share their expectations on this particular project with us? Anyone in the audience? No response? No one? You don't seem to be excited about this project, aren't you? You are not excited. You are. So come. Please give him a hand. Give him a hand.
Actually, we are expecting the best of our healthcare delivery, and we are expecting that our system will sync to the international level so that we will not be behind the national front when it comes to healthcare delivery. We are expecting much into our healthcare system than what we are seeing now. So that is why we are so much happy, and we are around to give our morale to help support this program that is about to be launched.
You didn't tell us your name and what you do?
I'm Jeremiah. I'm the psychiatric nurse in this hospital.
Okay. Let's give him a hand. Thank you very much. I can see our dignitaries have just joined us. As they take their seats, we will just move on and introduce them to all of us who are here present. Thank you. We may now take our seats. So at this juncture, I will introduce to you our guests, our special guests who are seated now, and then we'll all get to know who they are. In no particular order, distinguished ladies and gentlemen, we have our Chief of Staff. She's our special guest of honor in the person of Honorable Akosia Frema Osei Opari. Shall we please give her a hand? We also have the man in charge of this sector, our very own Minister of Health, who is our keynote speaker, Honorable Kweku Ajiman Menu. Please put your hands together for him as well. We have the Chief Director of the Ministry of Health, and she's in the person of Dr. Afisa Zakaria. Please put your hands together. And then the Director General, Ghana Health Services, Dr. Anthony Insiansari. Please put your hands together for him as well. We also have in our midst, gracing this occasion, Nene Gati and his entourage, Chief. Okay, I don't have this, but I'll get that for you shortly. He's a chief, is a paramount chief of the region. I'm yet to get that, but let's give him a round of applause and acknowledge his presence here. Nene, where's Olu? Nay. Oh, Dama. Mamo wa hade no what's it? Watch out one friend my send the moon dragon. All right, ladies and gentlemen, moving on. We also have our Regional Health Director, Dr. Alexis. Shall we please receive him and give him a round of applause as well? And then our development partners, I'll give you all their details shortly. All right. So, to welcome us, distinguished ladies and gentlemen, to this august occasion, shall we please welcome and receive Dr. Afisa Zakaria, who is the Chief Director, Ministry of Health. Shall we please put our hands together and receive her? I prefer we keep clapping till they come to the podium. Welcome, ma.
Thank you so much. Thank you, Mr. MC. Honorable Chief of Staff, Honorable Minister of Health, Ministers of State present, Honorable Members of Parliament present, the Chief Executive present, Director General of Ghana Health Service, Nananum, distinguished invited guests, friends from the media, ladies and gentlemen. It is a pleasure to welcome you all to the launch of the nationwide scale-up of the National e-Health Project. For those of you who have traveled long distances to be here, I want, on behalf of the Minister of Health and the entire ministry, to express our sincere appreciation for the effort you have made, especially our mother, the Chief of Staff, and her entourage. Thank you so much for making time to come. Computer-based patient record systems are now essential technology for healthcare, and key capabilities of electronic health record systems are being harnessed as central themes for health reforms worldwide. Within the last 4 decades, diagnostic equipment have digitally fashioned in ways that do not only cut costs, but also help to improve patient care and help the medical profession to make evidence-based decisions. Physicians do not have to search for lab, X-ray, and consultation results. Quick access saves time and money and prevents redundancy and improves care. That's care coordination. Electronic communication and connectivity to enhance communication among disparate partners is now an essential part of care. Electronic scheduling, electronic claims submission, eligibility verification, automated identification of patients are now being deployed to speed up administrative processes. Ladies and gentlemen, we are here today to launch an initiative that has gone through a first phase of implementation, and with the Winneba Trauma Hospital being a beneficiary. We have been able to demonstrate that electronic health record systems can be deployed in our circumstances and can yield the same benefits and savings as other countries. Chairman, this is sad to hear that some preventable deaths that occur in our health facilities are just due to breakdown in communication or lack of documentation due to disregard laid down procedures. Some, in actual fact, are also due to lack of concern by those who have been deployed or employed to take care of patients. But in many cases, the challenge is lack of access to previous medical history. It is for these reasons, and perhaps more, that we have assembled here today to support the rollout of the National e-Health Project, which provides scope for addressing most of these challenges we have mentioned. Ladies and gentlemen, we are aware that the deployment of such systems are not easy to accomplish without the full support and dedication of management and staff of our health facilities. But it is our intention to see improvement in the short term as well as medium term. And we believe that the path that we will chart after this meeting will lead to an overall improvement in the quality of healthcare we have in this country. Honorable Chief of Staff, Honorable Minister of Health, distinguished members present, on this note, I wish to once again welcome you to this very important ceremony, and that we wish you all will engage actively in the proceedings that follow. Thank you so much, and God bless you all.
Can we do one more, please? Great, great. Please pardon me this morning. I had to journey from Accra, and we had a few challenges on the road, so kindly pardon us. Now, to do the proper introduction, we have the Paramount Chief of Ifutu Traditional Area, Ne Gate, and his entourage, Nana Yamawakwaba. We also have our development partners, WHO, and the others all also present here this morning. We wish to welcome all of you. Thank you very much for coming. And then also, we have our Regional Health Director, Dr. Alexis Nan Beifuba. Now I have your name. Thank you so much. Well, you've heard that it is happening. We have been welcomed officially. It's now time to hear the project overview. And distinguished ladies and gentlemen, we have our consultants, Lightwave eHealth, the Chief Medical Officer, Dr. Maureen, to give us that overview. Shall we please welcome him?
Thank you. To the Chief of Staff, Honorable Ministers of Health, the Director General of Ghana Health Services, the Chief Director, Ministry of Health, Nananom, distinguished invited guests, and ladies and gentlemen. On behalf of the management of Lightwave eHealthcare Solutions, we express our sincere appreciation to the government of Ghana for this opportunity to contribute to the development of health in your country. We take this opportunity to thank the health authorities for their hospitality and for all their hard and dedicated work during the first phase of this project. This is indeed an ideal setting for all of us to learn more about eHealth, to make new contacts and share our knowledge and experiences on the use of information and communication technologies in healthcare. Mr. Chairman, when I started practicing as a medical doctor over 33 years ago, we kept handwritten health records and had face-to-face communications. There was no other way. But this has been changing ever since. Digital applications and digital solutions are part of our daily lives now, and even more so in the area of healthcare. It is now common for health records to be kept electronically. Patients' health information can be shared between health professionals in no time, regardless of geographic location. Remote consultations with a doctor over the internet facilitate access to care, save resources, and pave the way for telemedicine services across the country. E-health products and services are contributing to prevention, health risk management, and thus to more sustainable health care. It also generates income and jobs, while offering high-level technology solutions to patients and doctors, and also creates many possibilities for overcoming today's challenges in the Ghanaian healthcare sector. In Ghana today, there's an increase in health risk factors leading to increasing burden of non-communicable diseases that are suboptimally managed. This is causing chronic diseases and premature deaths due to the lack of prevention. The difficulty is that the number of people with chronic diseases is predicted to continue to rise, and this will put even more pressure on healthcare services. Already today, the cost of chronic diseases account for over 60% of the total healthcare cost in Ghana. Mr. Chairman, there's a huge potential in using e-health tools to help prevent diseases and promote good health. But this requires a shift in how we organize data from the point at which patients make contact with the healthcare facility until they are discharged. Lightwave e-healthcare solutions, as part of its engagement with the health sector in Ghana, brings on board an innovative partnership and tailored solutions to the practice of medicine to help the average Ghanaian obtain the best out of each encounter with the health care service. This partnership is also aimed at contributing to the sustainability of the health and social care systems, while at the same time creating new opportunities for business and health and the wider economy. The project seeks to improve the management of health data, from source to storage, and to provide critical but easy access to information for decision making. This is based on a strategic systems automation and networking at all service delivery points in all major hospitals and clinics in Ghana. It includes networking of hospital processes from medical records through consultations, admissions, diagnostic informatics to patient discharge and billing systems, and automation of all critical support services, including digital ordering of pharmaceuticals and medical appliances. The project also overhauls the disease surveillance system and transforms it into an early warning system in the health sector, making it compatible with the World Health Organization's Global Alert and Response Initiative. The scope of the project includes the enhancement of the physical infrastructure and facilities, and the development and deployment of hardware and software to ensure that data capture for the purpose of reporting to the National Data Center is enhanced. Data resulting from the operations of community health workers are incorporated and analyzed using geographic information system to help in decision making. Mr. Chairman, we in Lightwave eHealthcare Solutions believe that this is the right momentum to scale up such innovative approaches to serve citizens in greater numbers. But to succeed, we need to exploit and incorporate technological developments into our healthcare systems and improve their interoperability from policy to regulation and training. This is why we have taken the pains to ensure functional linkages with the National Health Insurance Scheme, the Food and Drugs Authority, and other regulatory agencies. Ladies and gentlemen, it is our firm belief that the Lightwave eHealthcare Solutions and Ministry of Health engagement will lead to a lasting transformation of the health system in Ghana, and I wish to call on all of you to be ready for it. Thank you.
Thank you, Dr. Morin. All right, let me share an experience I had with you. I walked into a clinic and I saw a doctor. And just after he had seen me, he said, from now onwards, whatever you do, stay away from all kinds of stress. Okay, so I'm thinking in my head, what is stress? Just as I walked out of the room, a lady handed me my bill. And looking at the way things went in the doctor's consulting room, I realized that the bill was going to be very, very high. So I told the nurse, please keep the bill. The doctor said I should stay away from stress. Distinguished ladies and gentlemen, at this point, we have a documentary to show you. So kindly feast your eyes to the projector screen. And let's all see it.
Sometimes you go to the records room to get your folder. It can't be located anywhere.
First, when clients comes, they have to wait for a long time at the OPD. But now with the e-health system, when they come, because the information starts from the OPD. Before they reach the ward, the information is already on the machine.
At first, when you come, what happened was that you come, even if you come early, you waste your time, you won't go, sometimes you come around 6 o'clock and you'll be going to the house around 3 o'clock, which was very bad.
The folders are misplaced, and then we don't have a big place to keep some of the folders. So we don't get some of the folders. We have to issue new folders for those who are already having the folders.
Health is continuity of care. At times you want to review whatever the patient brought in. So the e-health is helping us in that way. Not repeating, they can't find my folder and they will issue a new folder. No. We always have to be going on them. You want the new old folder, but if they don't get it for you, what do? Yeah, you have to restart.
It was not helping us at all. But now with the LEMS, we are going on folderless. You just come, I just add you to the system, then you are off of this place. Not going for searching any folder, retrieving any folder, just a one-on-one communication, then you are off from me.
Ghana Health Service, in collaboration with MOH and other partners, would like all the hospitals use one system. We can work with each other, we can transfer data with each other, we can share knowledge. With this software, as we have started with some few hospitals, we here in Trauma and Specialist Hospital is the facility that is leading in terms of its usage. So as you've seen from the OPD, we're trying to go folderless. Yes, and I think it'll be we want to get to the point whereby it will be paperless. So the patient's vitals were taken, and the patients were asked to go to consulting room, maybe 1, 2, or 3. You see a doctor there. The doctor types everything, key everything into the system, and asks the patient to go to the pharmacy. Time the patient gets to the pharmacy, everything reflects there at the pharmacy, and the patient collects the medication and goes away. Yes. Initially, it will look cumbersome, but as time goes on, my people are seeing that it's even faster and easier. It has cleared the issue of my folder is missing. Somebody has collected money to take a folder for me. I'm being victimized. I came before somebody in the morning. The person just came right now, and the folder has been seen and mine has not been seen. It has pushed all these things to the background, and I'm having my peace of mind in terms of this. And then going folderless is saving the hospital some money, because we use money to buy the folders, and it's not cheap. is expensive. So with this, you stand anywhere, either with a pad, some of the various wards are having pads that are established where they can stand anywhere within the facility and then make inputs, also making things very easy, you see. And I think our bosses in the headquarters, Ministry of Health and Ghana Health Service, they've taken the right decision.
Traditionally, it involves buying folders, patient folders from the regional medical stores, and then these are then sold to the patients, either they being cash patients or national health insurance patients. There's also a minimum period by which the folders cannot be disposed of. So the folders to have to be kept in archives. That also involves space and also employing people who have to retrieve and manage these folders also involves cost. The building of additional space for storage too does involve cost. That's to do with the traditional system. Some patients may end up having more than one folder. This is because each time they come to the hospital, they tend to forget or lose their hospital cards. And that means that they will need to acquire a new folder for their information to be written in. That's how we manage it traditionally. This is not only on the OPD level, but also with the inpatients as well, because the inpatient system really is a continuum or a continuation of the OPD. So whatever runs through the OPD tends to run through the inpatient system.
So you are discharging him on orals. Did you get it?
I'm Dr. Justice Asaya Mpuma, medical officer at Cape Coast Metro Hospital. This morning I came to do my morning rounds. I'm in charge of pediatric ward and the male medical ward. So fortunately for me, when I came, I might say I'm happy, and with the help of the e-health system from the Lightwave or Ministry of Health has made life comfortable for some of us. Because when you compare the e-health system to that of the olden method, sometimes you come to the ward and even getting the folder, you'll be surprised that you can wait for like 10-15 minutes waiting for patient's folder. Probably it has been sent to the pharmacy. So you have to wait till the patient is being returned, the folder is being returned back. Now with the help of the health system, you just go in, you log in, you ask your patient, you ask the patient what's the problem, you can easily assess, unlike the previous method that you have to wait for the folder. Secondly, I must say that it's simple. You just log in, just with your hand. You just don't move. A click away, you can easily request for your labs. Just enter, make an input, make changes. So comfortable. Even then, in the older method, we used to probably, sometimes the folders get exhausted. So you have to then wait for additional continuation sheets. They are a waste of time and the waiting time. But now with the help of the online, the e-health system, you just go in, you enter everything, you scribe, then you are done. So now I might say that the time you wait for patients as compared to previously, I would say that probably less than 5-8 minutes, you'll be done with the patients. Unlike the folder system that you can spend like 10-15 minutes per patient.
The Lightwave Health Information Management System does not clear the traditional folder alone, but also provides a comprehensive platform with additional benefits.
When it comes to capturing of patient information, vitals are captured, patient vital informations are captured, the history of the client is being captured, then diagnosis, drugs, so this is more comprehensive. And one other lesson I've seen about the system is that it's having a verification option for health insurance, which we are able to verify whether a card is active or not active, because it's linked to the database of the health insurance. Then we also have some sister facilities using the same software. So you can do global search and search for clients who have visited other facilities using the same software, and you can export their information, import it into your system, upload, and just do the updates. Their history, previous history will be there for you to work on. So this is more of a good health information management system that's more comprehensive.
Sorry, that's the medical director of the hospital. I can sit in the comfort of my office and monitor the activities of my doctors, and then see how the patients are being catered for. Because when I click on, say, appointment calendar, I can see all the patients that are supposed to be seen today. Then I can, for instance, click on a particular doctor to know whether the doctor has been giving patients to see. Yeah, that aside, I can also go to look for doctor availability. So within 24 hours or the whole week, I can go for it and see which of the days the doctor was available. Today, if I click, as I'm clicking, it's populating. See, I can see that almost all the consulting room, right from the morning, that's from 7 o'clock a.m., people started seeing. Patients were giving their folders and they were seeing. So it tells me that my doctors are available, including all the other prescribers. Hitherto, you will not know, unless somebody walks up to you or calls you that your doctors are not consulting. But now, immediately I come, I boot my computer, go to this page, and then start monitoring. So if I see that a particular consulting room is cold, there's no activity there, I then call the doctor and ask why, where are you? And then I'll get a feedback. So it's going to make sure, this system is going to make sure that I monitor every person works, everybody will work. Will work. So it's a very good system for us, the managers. And I can go to the patients as well, to the ward. I can go to the wards. If I go to the ward, like, and select, let's say, male ward, it tells me the number of beds there. And all the beds are mapped with patients' names. So if this morning the patient is supposed to take paracetamol and the paracetamol is given, it is ticked, and the remark is that saved. So if I look at the bed and then the patient is supposed to get a particular medication and it is not given, then I'll call the ward in charge and ask why patient A or B has not had, let's say, paracetamol.
Despite these potential benefits, there are barriers to the deployment of this innovation. Thankfully, this is being resolved a user at a time.
We've been to a lot of places where the program is being rolled out. And the first place we went to was Kaswa. And I think they are doing well with the system. I think Salt Pond is doing well. They've gone, I think, folderless. Yeah, they are no longer using folders anymore. And then today we are in Trauma Hospital. And I'm at the pharmacy now to help them, take them through the system. So far, so good. I mean, they've been fantastic. The system has really helped them. Now they can keep track of everything that is happening. They can see what's happening in the consortium and all that. I have absolute control over my medicines, and at the click of a button, I can see who dispensed what and where where it was dispensed to, and I get to know my stock levels in all the sub-pharmacies under me. So I think as a pharmacist is really helpful. I mean, at the click of a button, I get to see all these things at my desk. So it's really helpful.
Go to administrator.
Because I did like to see my name.
You want to see your name? Come to the dashboard. We've been to several places, including this hospital, People's Metro Hospital, the Sikuma, Abrodunkwa, Sopon Trauma Hospital, the Teaching Hospital, and other health centers like this other Urban Health Center, then Edumako Besiansi Urban Center, Swedro Government Hospital too. We have been there. So we train to equip them about the software, how they can use the software to manage their patient and to work on to documentation from records area up to the mortuary. Every aspect of it is covered on the software. Basically, that's the work we are going around doing. We are training all health workers, from biostatisticians, nurses, doctors, pharmacists, lab technicians, lab managers, laundry, kitchen, mortuary attendants, security. Everybody is part.
In this age of data, and I'm talking about quality data management, any software that is coming should be able to address three key things, to be able to give us warning signs of impending danger, which is epidemics. The second thing is to be able to give us true, accurate data on our performance as a sector and or as an institution, and to give us a forecast on what is going to happen. We have a fourth one, to be able to give us our money at the NHI, submit our claims on time, and then be able to get zero rejection rate, and be able to submit online at any time to NHI compatible with the NHI system. And then we have on-site bank, Zenith Bank. That system should be able to interface with the bank to make sure that the service we render and the cash flow are all well documented, and we can reconcile with our banks without any problem. Once any system that is coming to address the gatekeeper system and referrals from periphery to the central point like we have in teaching hospital should be able to be well integrated so that the data follows the patient. Data and then patient records should follow that person. We have trained a lot of people. This facility alone trained almost 600 clinicians, nurses, backups, and we have about 20 master trainers. The computers we are going to get, making sure that they are all well, the consulting rooms are all resourced, and the wards are resourced with tablet, computers, and then laptops. Quality data is key to any quality improvement initiative that are going to be launched, And we are in an age of data. Anything that is done and done well should be well measured and validated. That's the only way we can see that we are improving or we are not improving, and then what are the gaps, what are we supposed to do, and so on and so forth. So,
the certification, they are certified with the system, and even some, like I said, Ghana, those systems, because the things that they used to watch on television are now down here with them, so they are very excited about it.
I went to the pharmacy without a folder. I went to the doctor without a folder, pharmacy without a folder, the X-ray without a folder, but everything was okay.
I suggest that the system should be introduced throughout the whole nation so that people will not waste time when they come to the hospital.
It is a privilege to be working with Ghana's Ministry of Health on the National eHealth Project. We are very excited to be involved in deploying this solution, which will not only save lives, but it will also save money.
Using our expertise to build up this innovative solution for our great nation brings meanings to our lives.
Shall we put our hands together? Amazing testimonies of e-health systems. I think at this juncture, we can tell our neighbors that e-health has come and it has come to stay. Please turn to the person seated to your right or your left and tell them that e-health has come to stay. You're not excited saying it. You don't want it? Do you want it? Are you sure? Then please say it in a more excited mood. I see some of the young men trying to toast the young ladies. All right, distinguished ladies and gentlemen, this is something good for our health sector and, of course, for all Ghanaians who have had the best of healthcare experience across the world. We know some of you would go abroad just because you don't trust the healthcare system that we have locally. But this is to tell you that one step at a time, we are moving on to give you the quality service and, of course, the innovative service that you're seeing today, just like you would get abroad. So we should be happy about it. We have an implementation experience that will be shared with all of us here. And to do that is our host trauma and specialist hospital here in Winneba, a medical superintendent in the person of Dr. George Pra. Shall we please welcome him as he comes to share the experience with us? Please, until he gets to the podium, let's appreciate him. You know, sometimes when you are called and you don't hear the applause, it makes you feel there's a certain weight on your head. So please, thank you. Doc, welcome.
Thank you. Thank you very much, MC. Chief of Staff, Madam Akusia Fremose Opare, the Honorable Minister of Health, Honorable Koku Ajima Menu, the Chief Director of Ministry of Health, Dr. Afisa Zakaria, the Director General of Ghana Health Service, Dr. Anthony Insia Asare, the Central Regional Director of Health Services, Dr. Alexis Nan Baifuba, the Paramount Chief of Efutu Traditional Area, Neni Gati VII, the Municipal Chief Executive of Efutu Municipal Assembly, Honorable John B. Ninsin, all colleagues, medical superintendents and directors here present, heads of decentralized agencies, my enthusiastic and hardworking staff of the Trauma and Specialist Hospital, Winneba, the media, the clergy, ladies and gentlemen. I deem it a great honor and a privilege to stand before you as the medical director of the Trauma and Specialist Hospital, Winneba, which is currently serving as the Central Regional Hospital to host the launching of the Extraordinary Lightwave Health Information Management System, LIMS, nationwide. This system wouldn't have come a better time than this. The time within which there is a national agenda for technological information. The Trauma and Specialist Hospital, Winneba, fully embraced the utilization of the LIMS, considering the enormous benefit it has over other softwares for health information management. Madam Chair, the Trauma and Specialist Hospital, just like other health facilities across the country, is heavily criticized for the long waiting time. I think we saw on the clips that people were complaining of waiting time. But thankfully, with the implementation of the LIMS in this hospital, the waiting time at our outpatient department has reduced, and there is optimism that it will even further reduce to an appreciable level when our staff perfect the usage of this software. I'm happy to indicate that issues of missing folders, folder misfiling, and confusion as to who came first, among other things, will no longer be a worry to me. Madam Chair, in the government's agenda to reposition the National Health Insurance Scheme to respond to health needs of the people, the implementation of LIMS is indeed a testimony. The system is a lifetime verification of NHI cards to avoid fraud and also reduce claim rejection. In this regard, every patient who attends hospital with an insurance card is instantly checked for validity of the card on the system. This is it is a rare helping thing that helps us to actually fish out those who cross with fake insurance cards and then numbers. In fact, sometimes fake insurance numbers alone reduces our claims to the tune of about 12,000 a month. And sometimes I feel like weeping. But you go into it and it is true. It is true. And who are the people who are bringing all these fake cards? So with LIMS, I can just give thumbs up and then call the fake people to come and try us. They will be fished out. Madam Chairperson, I wish to indicate that there is no new technological system that does not face implementation challenges in the initial stage. Yeah. Enough though, even though the system is in its early stages, but we can see that it is reducing waiting time, which is a positive sign. And then the human factor in implementing softwares, though is there, we are seeing a decline. Because some can give a lot of reasons why they can't use the system. But with time, I could see that my people are having the enthusiasm and the readiness to perfect the usage of this system, which I think is gratifying to me. Madam Chair, I cannot end without bringing to your attention the key challenges confronting this hospital. The hospital is faced with inadequate accommodation to house some critical health personnel. We are unable to attract key personnel because of lack of accommodation, especially if you want a specialist to come and add to you. The first thing they put before you is accommodation, which we don't have. Madam Chair, another concern is re-equipping the hospital to play its role as a trauma and specialist hospital. The hospital, for some time now, has been making efforts to acquire these essential equipment for trauma case management. But as we all know, our resources are very minimal, that we aren't able to go the whole length. Madam Chair, Honorable Minister of Health, Director General of Ghana Health Service, MPs, Nananom, on behalf of the entire staff of the hospital, we want to say Ayeko for making trauma and special hospital work. Thank you, and God bless our homeland, Ghana.
Thank you, Doc. At this juncture, we have a demonstration, and this demonstration will be on disease surveillance system, and it will be done by Nrep Nihalani. I hope I pronounced your name right. Please pardon me. And then also Dr. Kofi Esiedu Bekwin, Deputy Director, Disease Surveillance. So these gentlemen will do us the honors. Shall we please receive them with a round of applause?
Thank you, Mr. MC. Honorable Chief of Staff, Honorable Minister of Health, Honorable Chief Director, the DG of Ghana Health Service, Nananom, development partners, including WHO, directors of ministries and agencies, management of staff of Unibar Trauma Hospital, the media, ladies and gentlemen. I think that I'm here today in RIP to give a short demonstration of what is it that's in store for disease surveillance. Apparently, it's in two phases. I will come out clearly with the current situation of surveillance in Ghana and then depict the gaps that this new intervention is addressing. And then I'll conclude with the benefits. So I've titled my presentation Towards Real-Time Surveillance in Ghana. That is the direction for the world. So it's not just Ghana, but that is the direction. So I'm Franklin Esiedibequin. I'm head of disease surveillance in Ghana Health Service. I think that the era we are in is an era of health security. Countries need to be safe so that your risk does not extend to another person. Being safe means that you need to be able to avoid outbreaks. Very, very critical. You need to be able to detect threats early, and then you need to respond rapidly. We are so happy that we have the Honorable Chief of Staff here, because when you talk about large-scale epidemics, it goes beyond our Honorable Minister. It's a bigger dimension to it. So the challenge is to address that gap. You need to be able to identify the outbreak early. That is the key emphasis. Early detection. Then you early report, and then we respond. In that case, the amount of dollars or cedis that we spent will be curtailed. So that's the essence of health security. And that's why the service and the ministry is happy with this new intervention. So Ghana has a surveillance system. And let me say that Ghana is not all part of Ghana, which is like maybe Unibar or Accra. There are parts of Ghana that are hard to reach, and it comes with its obvious challenges in health delivery. So we have a surveillance system which is integrated. That system exists to detect, to report, and then to respond. But then it has its obvious challenges. We have reliance on the health facilities, but then there are other events that do not report to health facilities. How are we able to detect them? So those are challenges that we need to be able to address in the health system. The idea is early detect, report, and respond. So over the period, Ghana has been able to detect some outbreaks. But the idea is that detecting outbreak is not the issue. It's the early detection which is crucial. So that's our emphasis. It's about early detection, early reporting, and early response. So this map shows you a few outbreaks that have occurred in Ghana. So clearly you see that they are the upper parts of Ghana. That's unique for meningitis. You have the middle parts, that's yellow fever. And you have the coastal parts, that's cholera. So we are obviously a country that are prone to outbreaks. So we need to have a system that can detect them as early as possible so we can use money to do other interventions. Our system over the period has achieved some notable successes. The picture that you are seeing on the right is when Ghana was certified Guinea-free in the year 2015. And I'm grateful that Dr. Afisa is here. She was very instrumental when we were working that part. So Ghana has a system. We had a last case of polio in 2008. It means that the system is in place. But the issue is that are we able to detect early so that the consequences are minimal? That is what we want to preach. So currently in Ghana, we have a surveillance system that has demonstrable capacity. I think that my few slides tells you that, yes, we are detecting outbreaks. But there are challenges. The surveillance system is not real time. When I say real time, it means that when the event is occurring now, can we detect it? And I think it's no. That's why I think that we are interesting times in Ghana now. So now, if somebody is in trauma center and there's an obvious event occurring now, we can actually detect it. So that is the real-time surveillance. It's not about aggregating data to detect. And that is what we want to look at. And our surveillance system also has another gap. It's about the events and their effects on outbreaks. We also have a challenge in that perspective. So our surveillance system now has two obvious challenges, which hopefully the new intervention is going to address. So NEP, take over and I'll conclude. Thank you.
Thank you. Thank you, Dr. Beku. Good morning, ladies and gentlemen. Thank you for being patient. What I'm going to do is I'm going to run you live through what's the system like. This is not a demonstration. It's a live of access to the system to see what's happening in real time. So Dr. Beku talked about the requirement for early detection. And the point is early detection of incidents as well as early detection of events are both critically important. In this demonstration, I will actually show you that how this system is going about taking care of events as well as taking care of incidents. And not only does the system try to cater to Ghana's surveillance requirements, which is about 43 events, cases, and conditions, but it also helps in identifying emerging infectious diseases which may not have become commonplace yet. So what we see right now, I think it's kind of light out here, but if you look at the screens of the televisions, you'll be able to see things clearly. Please look at them. What you're seeing on the screen is the list of centers from where the data is coming in. So currently, the LIMS system is running in these centers, and from there, data is being captured in real time. And if you see, there's a map which shows you these centers plotted on the map. The symbol green actually tells you that the information is flowing in right now. If any of these circles goes to yellow, it means that the center has sent information in the last 4 hours, but not right now. And in case the system is actually giving you red, it means that the system has not given you data for 24 hours. Moving on, we take a look at what this data does. So what is actually happening is that the data that is being captured, the electronic medical record data, the case data, it's gone? Okay. It's on? Is it back on? Okay. I think we have a power outage. They're looking at, okay, great. Thank you. So what's actually happening is that the electronic medical record data, including the consultations as well as the inpatient data, which includes symptoms, diagnosis, doctor's notes, nurses' notes, any complaints that were registered, as well as other information like laboratory and diagnostics. All that information is actually passed through multiple layers of a clinical algorithm. And this algorithm is what's known as a model. It's basically based on various syndromes. And this syndromic model helps in creating what we call triggers. So for the 43 Ghana parameters for surveillance, the triggers are being created and actually being provided in real time to the teams. Simultaneously, we see that there is the possibility that something new might be taking place. So it's possible that a new strain of malaria or a new strain of typhoid might come about, which has not been planned for. It's not something that you can predict. But what the system allows you to do is to put together various pointers about it and create these kind of alerts. And in these particular alerts, for example here, we're looking at some alerts which have been created by Dr. Beku, where he's tracking for diarrhea with vomiting on admission, and he can set a certain number of points like this, which when get captured, he'll get alerted to, which helps him get to this particular situation much faster than in case of aggregate data. This data is also provided as text messages and alerts, which actually can come to him at any time. It could be at 2 in the morning that he comes to know that there's a possible outbreak of something. Similarly, the teams can actually set up their own visualization graphs, as you can see on the screen. Here, in real time, they're able to actually see the data on the maps at the right locations and be able to take notes about them, notes which can go back to the facilities and tell them what should be done in real time. So they can actually start enforcing not only their reporting, but their response protocols in real time too. Finally, if they actually want to be tracking something which has reached near epidemic promotions, they can start tracking that part individually. So think of this like a weather map on a big screen, and on the big screen, they're able to actually visualize this data, and alerts that are coming through are actually given to them as sound alerts. Remember, this is not a demo of the future. This is currently happening. Besides this, it's possible for them to actually do event tracking. Now, events are those kind of incidents which are not understood very well. So, for example, there's a stream close by, and it's possible that a few traces of some sort of a mineral were found there which is not common. Or it's possible that there were a few dogs which were identified from an area which were possibly having rabies. Now, in that particular case, we don't know what is the cause of this, and we don't know what is the outcome of this going to be. For local teams to be able to report this to the national teams, we made it possible for this data to be given in real time. And the investigation protocol, with the use of a mobile app, as well as with photographs being taken, has been put into place. So as this particular event is actually investigated over a couple of days, all that data actually flows it in real time, and a final report can come out. Hence, bringing Ghana onto event-based surveillance as of today. I think that's all from me. Back to you, Dr. Beko.
Yeah, so yes, I have just two slides, but I think that I think the MC asked me whether we work for the same organization. No, we are Ghana Health Service, Ministry of Health, but we are convinced that the package works. So MREP is an entity. We are technocrats, but we are convinced of the product, because as I said, we have a surveillance system in Ghana that has worked, but it has not achieved what we want to achieve in terms of being optimal. So we are focusing on real-time surveillance. The emphasis is on real-time surveillance, so that the event immediately it's recorded, we are alerted. That is the essence, and I want it to be very clear. That's what we are preaching now. We are not preaching anything different, but it's about emphasis on early detection. So what is the benefit to us as a service? And I think that clearly there are screens or pictures that clearly tells you. So the idea is that I sit in our office with our team, and we have a link to the site, and at a point in time T, so now if it's what's the time now? Let's say it's 11:54. Yeah. When I enter the system, whatever it is that I need to see will be seen. And I think that is the biggest thing that we are talking about, and that's standard surveillance across the world. So it's about instant data transmission. And then the issue he talked about is about the triggers. Yesterday, I tried to sit in my office to say, let's set a trigger to early detect cholera. So I said with my boss, let's put diarrhea, vomiting, and admission. So any person who presents, let's say, to trauma at this time with diarrhea, vomiting, and is admitted, immediately I'll get an email that tells me that this guy could be a case of cholera. So that is the plus about this system we are looking at for. And I think that it is a good innovation that will help us to early detect outbreaks and then to respond to them. So we have the real-time dashboards, and then we have the event-based surveillance part. It's an informal way of collecting data, but yes, we are working with the team so that clearly Ghana can detect events very early and then respond. I'll end by saying that truly Ghana is on the path so that we can actually practice real-time surveillance. Thank you very much.
Well done. I think we can give them another round of applause, ladies and gentlemen. We're grateful to you, and we believe that with this demonstration, we are getting closer and closer into seeing the benefits of this e-system we are introducing today. On the program, we would have a speech which will be delivered by the Director General, Ghana Health Services. And she's in the person of Dr. Insia, I beg your pardon, it's in the person of Dr. Insia Asari. Shall we please receive him? Thank you, Doc.
The Honorable Chief of Staff, Honorable Akwesua Frema Osei Opare, Honorable Minister of Health, Honorable Kwaku Ajima Menu, the Chief Director of Ministry of Health, Dr. Afisa Zakaria, Nini Ayigate, the 7th Paramount Chief of Winneba Traditional Area, Nananom, development partners here present, health workers here present, distinguished invited guests, the media, ladies and gentlemen. I wish to express my appreciation to the organizers for inviting me to speak at this official launching of this laudable project, which preliminarily aims at promoting e-health to strengthen and improve health outcomes in the country. I consider the nationwide launching of the e-health project as one of the strategic pillars of the health sector reforms in Ghana. My assertion in this respect stems from the fact that over the last 3 decades, which obviously requires that we are doing things differently by embracing modern, innovative ways of health system strengthening. Moreover, using health information systems to strengthen health delivery is one of the 9 pillars of the Ouagadougou Declaration on Primary Healthcare Systems in Africa, which was recently reaffirmed. Attributed to the fact that systems for data collection in the health service are fragmented and do not communicate with each other. This is especially so in hospitals where diagnostic systems have no direct link with other service delivery sectors like medical records, pharmacy, and other supporting services. Mr. Chairman, distinguished ladies and gentlemen, it is noteworthy that the net effect of the aforementioned concerns is that control systems do not exist, and performance statistics contain too many gaps to make them realistic. Service coverage data, therefore, are only reliable through surveys and which are relatively expensive. E-health, therefore, holds a lot of promise in helping countries like Ghana to make strides that are urgently needed for improving the health of our communities, especially those in the rural and the hard-to-reach areas. It is therefore noteworthy that the government of Ghana Information and Communication Technology Policy is ICT for Accelerated Development, states, among others, that ICT will be utilized to promote national development. The National E-Health Policy Strategy, therefore, provides a framework for engaging consumers of health service and others. It is noteworthy that this is what the Ministry of Health and Ghana Health Service want to use to give health for all the people in this country. I would like to mention a few things that we are doing. For example, what we are witnessing this morning, the launching of lightwave e-health systems, which is supporting 26 health facilities, ranging from primary health care centers to teaching hospitals, to deploy health information systems. Close to about 70 faith-based, that's child health institutions, are also supported by Infotech to deploy hospital administration management system, HAMS. In addition, the ministry has also procured digital X-rays and automated laboratory analyzers, which has been distributed throughout the country. So anybody can take an X-ray somewhere and it will be read and interpreted by radiologists at a faraway place. A similar approach has also been used in early infant diagnosis for HIV/AIDS. For example, we are using what we call DBS, the dry blood samples, where laboratory tests are taken for HIV mothers, and they are sent to the laboratories, and the results sent to the midwife at any place by using a WhatsApp or a text message. The health sector in Ghana has also been leveraging telemedicine to facilitate access to health care and improve referrals. I'll give you a few examples. For example, the Millennium Village Project, MVP in Ghana, piloted telemedicine in Amansia West. They created a teleconsultation center in Kumasi, and we have trained nurses, midwives, and doctors who give teleconsultation to people in the remote areas without the patient moving to the health hospital. The Climate Change and Health Project funded by UNDP in Ghana has also supported similar telemedicine projects in Ketaa District Hospital in the Volta region. In the same way, the Ghana Health Service has also deployed the DHIS2 e-tracker to help register all pregnant women, children, and HIV and TB patients to ensure that they are not left out of receiving scheduled care. The adolescent health program in Ghana, and for that matter in Ghana Health Service, is taking advantage of the social media in this country. They are using, the adolescents are using a Facebook page with interactive contents to engage the adolescents. They also have developed mobile applications which can be downloaded from the Google Play and Play Store, and it's called GHSYMK. Through this, a young lady who is getting to a menstruation will learn all about menstruation, will learn about sex education, and they also will learn what to do and what not to do when you are in adolescent stage. We are also using what we call the mHealth subcomponent of eHealth, which is extensively to support the community service delivery using first digital assistance and epi surveyor, which have been used for some time. We're also using what we call the MOTEC registered all pregnant women so that they are not left out to go to antenatal care. The Millennium Village Project in Amansia West has also deployed mobile phones for community health workers for use for service delivery, surveillance, and reporting using the home care applications. So what Dr. Queen said, we will not only depend on the hospital facility records that we get, but community health workers who are assisting community health nurses can have real-time data which will be sent onto the DIM system, and then we can detect any disease at any time. Mr. Chairman, I will say that this would, however, be the need to also strengthen our legal and policy environment, which we need to implement such advances in e-health to ensure that this country fully benefits from the e-health project. Ghana, like most countries in the sub-region, continues to experience epidemic outbreaks. The main problem is that while a disease surveillance system exists, as Dr. Queen said, the service does not have reliable early warning systems. And therefore, capturing outbreaks at the early stages is a problem. Thus, the threshold for responding for epidemic diseases are only noted when the epidemic has already taken place. To respond to these challenges, we must, as a matter of urgency, modernize our infrastructure and healthcare delivery through widespread adoption of electronic health records, such as the one being launched here today, that will generate enough data to change the practice of medicine. I therefore consider the launching of this as very timely in view of the multiple benefits which has already been shown that the health service stands to obtain from the e-health systems of health strengthening. Honorable Chief of Staff, Honorable Minister, from the aforementioned exposition of e-health, I'm of a firm belief that the health sector needs to take advantage of these developments as quickly as possible and make benefits available to the patients. Clinicians also stand to benefit because in order to make evidence-based decisions, they need high-quality data obtained from multiple sources, such as inpatient, outpatient care, acute and chronic settings, urban and rural care, and populations at risk. This can only be accompanied with electronic health records and discrete structured data, such as the one being launched here today. Distinguished ladies and gentlemen, healthcare data needs to be combined or aggregated to achieve statistical significance. It is, however, quite worrying that most of our primary healthcare centers is delivered by small facilities such as CHIPs, compounds, and clinics with relatively small patient population, thus making aggregation of data necessary. However, for the large healthcare organization or facilities, there is also a large number of data generated from widespread electronic health records, which requires a new data analytic tools. I wish also to inform you that the folder system is currently in use in the service, which lacks the ability to integrate with other printed forms of information. The ability to integrate health records with a variety of other services and information to share the information is therefore critical in the future of the healthcare reform. I'm delighted, therefore, that the digital, unlike the paper-based healthcare information system, can be integrated with multiple internal and external applications that will make sharing of health information possible, and it can integrate with analytic software for data mining. I'm reliably informed that the e-health project comes with enhanced physical infrastructure facilities to enable the Center for Health Information Management and the Disease Surveillance Unit of the service come together to perform its comprehensive surveillance function for the country. Moreover, as it is designed, it forms the basis for the establishment of a Center for Disease Control, which can be further developed as a training center in the future. So, Honorable Chief of Staff, what Ghana Health Service is saying is that as a matter of urgency, we should use this as a base to establish Ghana Center for Disease Control, which we can use for the sub-region. It will bring direct foreign exchange, and it can also be a system that we can use to do surveillance for the whole sub-region. And this, we hope, by the second quarter of this year, will be possible. There are several areas where the service expects improvements, especially with respect to patient safety. Notable among the areas are improved legibility of clinical notes, improved access anytime and anywhere, but of course, under strict protocols, reduced duplication, reminders that tests or preventive services are overdue, clinical decision support that reminds clinicians about patient allergies, correct doses of drugs, to mention but a few. It is therefore gladdens my heart that with the launching of the e-health project, all this information will be available at a glance and will save time and resources to improve claims management and enhance conditions of service. I can see that the Deputy Director of National Health Insurance is smiling. We want to have zero tolerance for claims rejection, and this will help us. Honorable Ministers, Honorable Chief of Staff, distinguished invited guests, in bringing my statement on this occasion to a close, I wish to assure you that as a service, we are poised to adopt the e-health project to partly address the current operational challenges which confront data management at all levels of service. The Ghana Health Service is indeed glad to be part of this innovation and transformation, since e-health has the potential strengthening of our weak health system to make our more adaptable to meet the needs of the country. And I believe with e-health introduced in this country, we can achieve, and I qualified it, we can achieve quality universal health coverage for all Ghanaians by the year 2030. Thank you, and God bless all of you.
Thank you also very much, Dr. Anthony Nsiasari. We are most grateful to you. At this point, we will receive our keynote speaker, and I crave your indulgence to kindly give him a resounding round of applause as we welcome the Minister for Health, Honorable Kweku Ajiman Menu. The applause could be louder, please.
Sure. Hello. Stop picking. Want to put it beyond there. That's okay. I'll try not to touch it. Will it pick now? Yeah. Hello. Honorable Chief of Staff, I think I'll have to address myself to the Municipal Chief Executive, the Director General and the Medical Director of the Winneba Hospital and Trauma Center, and your staff, the Regional Director, and the Paramount Chief of the Futu Traditional Area, the Nyigate, Nananum, the World Health Organization representative in Ghana, we are my own friend, donor partners, distinguished invited guests, ladies and gentlemen. Let me commence by thanking the Chief of Staff for finding time to be with us today and to set the stage for the realization of yet another promise of this administration. The vision of e-health is well captured in the MPP manifesto. And so it is just a matter of time for the full potential of that promise to be delivered. On page 118 of the manifesto, the President and those of us following him assured Ghanaians that we will utilize the best of technology and health insurance management protocols to tackle waste, corruption, and insurance claim fraud under the National Health Insurance Scheme. This, we said, will include completely phasing out the manual processing of claims, which currently stands at about 90%. Tightly linking services and drugs to hospital attendants and treatment